Welcome to our channel Nursing Tutorial. Important nursing question and answers. Question number 1. What is the incubation period of chickenpox? Answer is C. Chickenpox has a variable incubation period ranging from 10 to 21 days. Question number 2. Which is the first sound heard in Korotkov sound during BP measurement? Answer is B. The first sound indicates the systolic pressure. Question number 3. Which of the following is the vector-borne disease? Answer is B. Dengue is transmitted by Aedes mosquito. Question number 4. Which of the following is the protein-rich food? Answer is C. Eggs are the complete source of protein. Question number 5. Which hormone regulates calcium level in the blood? Answer is C. Parathyroid hormone increases serum calcium by actin bonds, kidneys and intestine. Question number 6. Which site is preferred for IM injection in adult? Answer is A. Deltoid is commonly used for small volume IM injections. Examples are vaccines. Question number 7. What is the normal body temperature in Celsius? Answer is B. Normal body temperature is approximately 98.6 degree Fahrenheit or 37 degrees Celsius. Question number 8. What is the function of red blood cells? Answer is C. Red blood cells contain hemoglobin that carries oxygen from the lungs to tissues. Question number 9. Which drug is used to treat hypertension? Answer is B. Amlodipine is a calcium channel blocker used to manage high blood pressure. Question number 10. Which is the most common cause of anemia worldwide? Answer is B. Iron deficiency anemia is most prevalent due to poor dietary intake or blood loss. Question number 11. Which pulse site is used during cardiac arrest? Answer is B. Carotid artery is the best felt during CPR to assess central circulation. Question number 12. Which nutrient is essential for wound healing? Answer is B. Vitamin C aids collagen formation and tissue repair. Question number 13. The primary symptoms of dehydration is? Answer B. Thirst is the body natural response to fluid deficit. Question number 14. The Mantoux test is used to diagnose? Answer C. Mantoux test check for TB exposure through a skin reaction. Question number 15. Which electrolyte imbalance can cause cardiac arrhythmias? Answer A. High potassium level affect heart muscle conduction. Question number 16. Which of the following is fat soluble vitamins? Answer C. The fat soluble vitamins are vitamin A, vitamin D, vitamin E and vitamin K. Question number 17. Which of the following is a symptom of increased intracranial pressure? Answer A. Cushion triad means bradycardia, hypertension and irregular respiration are seen in increased ICP. Question number 18. Which condition requires contact precautions? Answer C. Scab is spread by direct skin contact. Use gloves, gown and isolate the linen. Question number 19. The normal serum potassium level is? Answer A. Normal serum potassium level is 3.5 to 5 mEq/dl. Less than 3.5 is hypokalemia and greater than 5 is hyperkalemia. Question number 20. The position given to a patient after spinal anesthesia is? If you know the answer, comment in comment box. Thank you for watching my video. If you want more videos, please subscribe my channel. Thank you.